Thank you very much, ladies and gentlemen. Today we're going to talk about the coronavirus pandemic and focusing largely on our vaccine program. You're all aware that we have had this pandemic with us. Our first case, that's the index case, was determined sometime March last year, to be precise, about March 13. So from then until today, we're talking about 1 year to about 9 months, during which we have been battling this pandemic. Now, in that intervening period, we have had several consequences arising from this pandemic. You're all aware that lives have been lost, livelihoods have equally been disrupted or lost. Our social and economic lifestyle have been disrupted. So really, we could not have really wanted anything more than having a vaccine being discovered and being brought into the country. And not just for us alone, it's a global thing. Most people around the globe were looking forward to having a vaccine against this pandemic discovered. So it was really a good thing when several countries did announce that they have been able to discover a vaccine against the coronavirus and against the pandemic in general. For us here, we'd have expected that when the vaccine was brought into the country, many people would have rushed to have them being vaccinated, considering what this pandemic had been able to do in our social lifestyle. But that was not exactly the case. We received the first consignment of the vaccine sometime in March, around about March 3rd this year. And the first dose was given out on 5th of March. Now, thereafter, the expectation was that the booths would have been experiencing large numbers of Kenyans turning out to be vaccinated, especially those that were in the first group to be vaccinated: the teachers, the security personnel, the healthcare workers in general. But that was not the case. There was a lot of hesitancy regarding people turning out to be vaccinated. And therefore, even our target as a government of having 10 million people to be vaccinated by the end of this year, we are hurtling toward there, but not exactly there. Right now, we have been able to vaccinate around about 7.5 million Kenyans, out of which there are those that have been vaccinated fully, and there are those that have been vaccinated partially. For those that have been vaccinated fully, the figure is about 3 million, and those that have been partially vaccinated, we are talking about 4 million. In terms of the vaccine quantities that we have in the country, as of now, from the time that we received the first consignment to this very moment, we have been able to receive about 16 million doses. And what we have that is in our stores right now, and those that have been given out to the vaccination post and final facilities, we're talking about over 6 million. But in the stores right now, in the central store, we have about 3.4 million. So really, we have sufficient vaccine in the country to be able to give jabs to our people who would come forward to be vaccinated. But why is it important for us really to be vaccinated as a people? We have been able as a government to inform our people about the importance of obeying the containment measures that have been advised by the government. These are wearing of face masks, observing social distance, while at the same time, sanitizing or washing hands. But the vaccine now is an additional containment measure so that you can be able to reduce the rate of transmission or infection and be able to reduce or lower down our curve of infection. They have largely been able to bring down the infection rate, and the curve has also come down. But we need to do a lot more so that we can be able to open our country, in totality. On the 20th of October this year, during Mashujaa Day, the President did open, some portion of economy, but there are other areas that are, there's an adjustment upward, but still they're not fully open. And we need, therefore, to have a good number of people having been vaccinated in order for us to open the economy entirely. Experience has shown that countries that have been able to get back to their normal economic life have had critical mass of the population having been vaccinated. And therefore, appealing to our people to come forward and be vaccinated. In addition to open the economy, what else? Why else do we need to be vaccinated? One is that when you get vaccinated and you happen to catch the virus, the severity of the disease will certainly be down or be low as compared to if you catch the disease and you are not vaccinated. But number two is only that the possibility perhaps of dying will also be reduced, and therefore it is really important to have this vaccine. And also being hospitalized. You may not end up being hospitalized if you catch the virus and you have been vaccinated. Sometimes, after vaccination, it may just pass as a normal, mild flu, which would have been different if you had not been vaccinated. And therefore, the appeal here and urging our brothers and sisters is to come forward and be vaccinated. The final thought that I would like to put forward, ladies and gentlemen, is that this is not a war that can be fought with the government alone. The government did indicate that to come and access services in government, you need to have been vaccinated, which is basically to encourage our people to go and get vaccinated. Because indeed, when you get vaccinated, you are not very likely to pass the virus to the person offering that service, and therefore the vaccine protects you, but also protect the person who is to offer you that service. And therefore it is important for our people to understand that it is not necessarily that the government is forcing you to be vaccinated, because it is voluntary. But if you want to access government services, then you need to be vaccinated before you come to get that service. And the whole idea being to protect you and to protect the person whom you're going to expect to serve you when giving that service. And therefore I want to end it there, so can open it for questions and answers. Thank you.